Hi people, the focus of this video is to learn the adverse effects of phenytoin. Phenytoin is an anti-epileptic drug. See, phenytoin has dose-dependent toxicity as discussed in the previous video. So it is essential to monitor ECG. First it will be first order kinetics. Then when all the enzymes get saturated and you have injected a lot of phenytoin, then it will not be able to metabolize via the enzymes. So it will follow zero order kinetics. So it will plasma half-life will increase almost to 60 hours. Hence, phenytoin will cause toxicity. It can accumulate and cause toxicity. It also irritates the vascular components a lot. Phenytoin, hence there are a lot of side effects. All the side effects seem to start with H. So H is a H for phenytoin. Hypertrophy and hyperplasia of gums. You can see here whenever you give an anti-epileptic, there can be hyperplasia of gums because of defect in collagen metabolism. Actually, there could be hypersensitivity, hypersensitive reaction. You can write almost for any drug. Then there can be hepatic necrosis. There could be hirsutism. Hirsutism is because of the increased androgen secretion. There can be hirsutism. All this because of epileptic drugs. Remember, you told the person you won't get convulsions, take this, and that person comes back with a beard like this. Hyperglycemia, it can increase your blood sugar level because of decreased insulin release. Then coming to folate deficiency, which can cause megaloblastic anemia and also neural tube defects if the person is pregnant. Osteomalacia due to increased metabolism of vitamin D. What doesn't it cause? It causes everything on earth, I think. Increased metabolism of vitamin D, so there's lack of vitamin D resulting in osteomalacia. Hypocalcemia, because calcium cannot be absorbed because vitamin D is less. Fetal Hydantoin syndrome, because remember phenytoin is a hydantoin, so there can be fetal Hydantoin syndrome where it can be cleft lip, cleft palate, digital hypoplasia, etc. All these constitute what? Fetal Hydantoin syndrome. Fetal Hydantoin syndrome. At high concentrations, what happens? So it is not a CNS depressant. We have already discussed this for you in the beginning, right? We have told you phenytoin is not a CNS depressant. It can, at high concentration, it can cause a lot of CNS symptoms like tremor, headache, psychological disturbances it can cause. Main thing is it is a CNS drug, remember. So it can cause a lot of vestibulocerebellar symptoms. So think, first of all, when it comes to your mind, they ask you phenytoin side effects. What you think? What is it trying to do? It is trying to work on the CNS. So on that itself, the side effects can be. What and all can be the side effects? Vertigo, ataxia, tremor, headache, nystagmus, psychological disturbances. Okay. Coming to CVS, there's hypotension, cardiac arrhythmia can occur. GIT, like I told you, there can be nausea, vomiting. Hence, you have to give phenytoin after food, which is good, right? Have the food, then take the tablet. Can we revise now? Very good. Revision better happens when we don't look at this. Let's try to recollect. Ready? Excellent. Start. Tell me. Phenytoin, anti-epileptic. You gave this to the person comes back to you telling that he has gums issue, he has hypersensitivity, she will have a hirsutism, then there can be hepatic, what is that? Hepatic necrosis, there can be hyperplasia of gums, we told, right? Hyperglycemia, he can land up with diabetes. Hypocalcemia due to vitamin D being less, that can also result in osteomalacia. Fetal Hydantoin syndrome, because of which there will be what? Cleft lip, cleft palate and digital hypoplasia. Then you have at high concentration again HHH, CNS, vertigo, ataxia, tremor, headache, etc. CVS, hypotension, cardiac arrhythmias, GIT, nausea, vomiting, etc. Hence give phenytoin after food. Here whenever they ask you adverse effects, you can write dose dependent elimination, right? All that you can write. Fine. Got it? So we are closing this video on the adverse effects of phenytoin or the anti-epileptic drug phenytoin. Okay.